5 or 10 years ago, when people come for treatment here for dizziness or vertigo, and when I diagnose and I report to them saying that, hey, you may have BPPV. What did you say? Was it that BPPV? What is that? Can I write it down? Could you write it for me? Thanks to the AIs and internet, people now walk into the clinic, just ask me, hey, Anthony, I have a BPPV, probably. Can you do a maneuver? Yes, it could be BPPV. However, there are several other causes which could lead to a vertigo. Not all of them are treated the same way. In BPPV, the crystals inside the inner canal are wrongly positioned. So this gives a wrong signal to the brain. This wrong signal, when it is perceived and compared with the information from the other systems, the brain may take a while to understand which exactly is right. So this brief time is experienced as vertigo. Apart from BPPV, there are other inner conditions which could result in dizziness or vertigo. So conditions like Meniere's disease, vestibular neuritis. Here, your balance nerve, which takes the information from the vestibular system to the brain by itself, is affected. It could be infected or inflamed or whatever reason. Instead of short spinning, they may experience more than that. I mean, like, there will be continuous spinning. They may have a sense of imbalance, nausea, fullness in the ears, and even tinnitus, that ringing sound inside the ears. So this may behave different from a classic BPPV. Sometimes vertigo can come from the brain or the central nervous system. The central nervous system is the place where the information is received, processed, and these informations regarding the sense of balance arrives from the vestibular system or visual system and the rest of the body, which is the somatosensory system. And this processing, when is not so efficient for any particular reason in the central nervous system, could also cause vertigo. Although these are less common, it is important to keep in mind. Another common cause is migraine-related vertigo. In migraine, the brain becomes sensitive to light, movement, sound, and visual stimulus. And this may result in our balance system becoming unstable. Some people may not even have a headache, but they may perceive as dizziness and vertigo. So this dizziness or vertigo is, the perception is very different from a BPPV and needs to be treated very differently. It's not a maneuver which will fix it. We also see dizziness related to the neck, dizziness or vertigo related to the neck. Our neck has receptors about the position of the head. These receptors sends information along with your vestibular system and the visual system up over to the brain. When the neck muscles are tight, joints are stiff, it is a poor posture, or for any instance, if the neck is not in the best position to send those information, these informations could be mismatched from the other systems, which in turn could be perceived as dizziness or vertigo. So, and we call this as cervical dizziness or cervical vertigo. And also, it has nothing to do with the maneuver, so it's just treat the neck and the dizziness become okay. Sometimes jaw problems could also result in dizziness. The jaw joint is very close to the inner ear, and they share the same muscles and the nerves. The problem in the jaw, for instance, if it is a tight muscles or the joint by itself is irritated, this could affect the surrounding system, which is the inner ear and the vestibular system over here. So when this affects, it is not just dizziness, and the patient may experience more than dizziness symptoms like fullness in the ears, tinnitus, and heaviness over the ears. So this is also not just treated as one maneuver. So we need to see the whole system, whether it is coming from the jaw or the inner ear. So we see the whole head and neck system, and then we assess it, and then we will have to make a differential diagnosis and treat. So there could be more than one person involved over here. There could be your ENT coming into play, an audiologist coming and supporting, a physiotherapist working on the jaw, the TMJ, the neck, and the vestibular system, and repositioning maneuvers if needed, and the exercises. So when treating a BPPV, it is very important to understand what exactly it is, whether it is a BPPV or other conditions. So we don't approach a condition as BPPV, rather we approach a problem as vertigo, and then find and identify what exactly is the cause for that vertigo, and then we could be one or more of a person in work for this particular patient. As I said, a doctor would come into, or a neurologist could sometimes have to identify and rule out causes of the central nervous system. It could be an audiologist to find is there anything wrong with the auditory system, the nerve, and infection which is over there. And by the same time, a physiotherapist could be doing the maneuvers, the exercises, treating the neck, treating the jaw, and managing the other symptoms associated to vertigo. So it's always a teamwork, and it is not that one person takes the credit and says that this person is better for BPPV. It doesn't work like that. It's always a teamwork. There is another interesting condition called as PPPD. So in this condition, our nervous system becomes hyperactive, and they start to be in an alert mode, and it's kind of like a trigger mode or overactive mode. So normally it happens after an experience of a vertigo. A person experiences vertigo for some reason, and after a period of time, the alert mode senses even simple normal movements as abnormal, and this nervous system is now in fire. So it continues to sense movements, and then people perceive this as unsteadiness and dizziness, and it's consistently over there. And most of the patients also say that they have a sense of floatedness. And this patients also would experience any changes in the environment to be difficult. They find it difficult to maneuver in the mall, crowded places, and they start to feel dizziness. And then over a period of time, this is also accompanied by anxiety and fear. So the treatment is more about training them, and so the exact way we say is called as habituation exercises. So we accommodate them to different challenging environments slowly and steadily, so that the brain comes and calms down the nervous system and the anxiety. So the treatment may also include referral to somebody who can work on their confidence, but primarily the exercises are the mainstay of treatment over here. So in summary, not all vertigo is BPPV. Different causes, different treatments, although the symptom is the same. You ever want to understand what exactly you are going through, I'm here at Physio. My name is Vinod Anthony.